Hello students, we will discuss about the very important imaging today. All of you know that X-rays is good old basic imaging with the contrast often. Then ultrasound also very useful initial screening method in most of these places. CT is very good imaging as such. Of course MRI and other things also, including PET CT and so many modifications. These are at least basic imaging technique, which is again very essential in the current surgical management of the patients as such. So you just see what this image is. Let's see and tell what is this image is. Okay, look at that. There is a contrast here. Limbs are seen, and it's the main area is seen. This is the negative film of that, which is the color placement over the same film. So what is this? The same patient, three different films are given to have few modify the images, and so they have the better look of the images as such. So what is this image is? It is CT angiogram. That is important. This CT angiogram is the currently dynamic one, and which is mainly done in different areas, everywhere it is done. In the lower limb, vascular disease is very commonly done, upper limb also, to see the vasculature in the vessels, mesentery, abdomen, different areas, coronary angiogram is there. So same thing in the surgeon, in the lower limb very common, peripheral vascular disease, atherosclerosis, TAO, and vasculitis, and old age, diabetes patient, vascular narrowing is very common, and different levels of the blockage is there, which you can always go through my book about those classifications and different causes as such. So this is the film of exact looks like CT angiogram. So what you look for, what findings you look for? Site of the block. Look at that. Here is the block. You can see that here is the block, main block. So a few blocks above. You can see here also block. You can see here block. You can site of the block. Extent of the type: narrow segment, wide segment, multiple sites, multiple blocks. Severity: how much was 75%, 90%, total block, and the presence of collaterals. There are few collaterals here. These are the collaterals. So collaterals improve the perfusion. Through the collaterals, main vessel may get filled, the distal part, tissues may get filled adequately, so maintain the perfusion. That to compensate the obstruction. So that is called distal runoff. So perfusion through collaterals to maintain the perfusion distal to the block in the main vessel. So how much it fills in an angiogram, that is called distal runoff. If it is adequate and good, that means that is compensated, you will be able to save the tissues or limb distal to the block. Of course, you have to do different angiosome, then local this one, angiogram, stenting. You have to improve the circulation by drugs, all those things that is there. Drugs, angioplasty, direct vascular surgery, arterial surgery as such, maybe graft, maybe saphenous vein, in situ, reverse, and so on. All those things are there in the book. You can go through that. Distal runoff, that is called, this is very, very important. Presence of color, the two things. Site of block, extent of block, presence of color, distal runoff. Gives a clear idea about what you are going to do, how severe disease is, and you can always define accordingly whether it is functional limb ischemia, also called as the decompensated peripheral vascular disease. Block is there, but it is compensated well with the collaterals, so you can save the limb. Whereas the decompensated peripheral vascular disease, also called as critical limb ischemia, they got a rest pain, ischemic ulcer, gangrene, pre-gangrene, and pain is not subsiding by any drugs for 2 weeks or more, and with the altered ankle pressure, ABP index, ankle pressure index, and toe pressure index, all those things. So that is the critical limb ischemia. So definition also you have to know, functional limb ischemia also you have to know the pathology, how much collaterals, how much distal runoff, whether you will be able to save the limb or not. If you want to save the limb, what surgery or what intervention, whether you have to do a radiological intervention, or do a angioplasty by stenting, or you do a direct arterial surgery by putting a graft, or whatever it is. So all those decisions can be made very well by doing a CT angiogram. That is called dynamic CT angiogram. And many times what they do is conventional CT. When you do angioplasty, many do that with the conventional CT angiogram, so that the C-arm guidance you can put. That is a conventional one. DSA is a digital subtraction angiogram, where bone is eliminated, so that quality of the image will be very good, so that you can have the clear idea as such. And retrograde angiogram is Seldinger technique, good old technique, but currently it is the CT angiogram, which is mostly commonly done through the femoral artery pass the arterial cannula, then pass the catheter, arterial catheter proximally, then inject a dye, and you can both sides you can do a angiogram. You can do the brachial artery also, you can do that. That is called retrograde Seldinger technique angiogram. And of course, aortic angiogram, aortic this one, aortic puncture under guidance. So these are the different types of angiograms. Complications are dissection, thrombosis, bleeding, and further block, infection. So all these things are the complications of angiogram. Of course, currently available antibiotic technique and different instruments set up, everything has reduced the or minimized the complications as such. So you have to say common short note asked, Viva they will ask, MCQ they will ask, Oxy they will put. So you should know it's very common entity, long case kept in the exam, peripheral vascular disease, where they will ask about CT angiogram, what do you look for, what is the literal runoff, what are the different types of angiogram, complications, how to do, meaning of Seldinger technique as such. So MR angiogram also sometimes we will do depending on the situation as such. So that is decided by the radiologist and often by the vascular surgeons as such. So all these things are important. So remember, this image is very important in the exam. They will keep Oxy, they will keep short notes they will ask in the exam. So you have to know everything about that. So please you can go through about my surgical method, clinical methods in surgery current edition, SRB Manual of Surgery current edition, and of course operative surgery book, and tissue approximation skill for skill, and detailed lectures are available through DigiNow, through JP Publishers, everything accordingly CBME, all lectures basic to detailed specialties, urology, neurosurgery, cardiothoracic, and instruments, specimens, operative surgery, also it is there, X-rays also there, images also there, with the different lectures in detail. You can always purchase that DigiNow lectures for a year, and entire thing will be learnt and understood very well through that. So students, I hope you understood basics about the CT angiogram of the lower limb as such. Thank you very much.